I'll now turn things over to Sarah Berkowitz, one of the NASI interns from the Congressional, who's interning with the Congressional Research Service.
So, good morning, everybody. I don't know about the rest of you, but I'm awake now. So, it is my pleasure to introduce our first panel to you, Social Security, How Does It Work? My name is Sarah Berkowitz. I'm a NASI intern. I'm placed at the Congressional Research Service, looking at long-term care issues. I'd like to briefly introduce our panel members who are getting themselves seated. First, we have Kathleen Romig, who is an analyst at the Social Security Administration's Office of Retirement Policy. She has also analyzed Social Security policy at the Congressional Research Service. She began her government service as a Presidential Management Fellow, where she completed rotations within SSA, the U.S. Department of Agriculture, and at the Office of Management and Budget. She received her master's degree in social policy from the University College Cork in Ireland. Then there's Scott Szymendera. He is an analyst in disability policy at the Congressional Research Service, where he provides an analysis to Congress on issues related to the Social Security disability programs, as well as on a variety of other programs that provide benefits to persons with disabilities. Before coming to CRS, Szymendera worked at the Rutgers University Program for Disability Research, and he earned his PhD in political science from Michigan State University. And our third speaker is not here yet, but she says she's going to be coming in, so we're going to start without her. Her name is Ashley Carson Cottingham. She is the staff director with the U.S. Senate Subcommittee on Primary Health and Aging, on Health, Education, Labor, and Pensions, the HELP Committee. Prior to that, she was the executive director of OWL, with the Voice of Midlife and Older Women, founded as the Older Women's League. During her time with OWL, she worked closely with the Leadership Council of Aging Organizations as the co-chair of the Income Security Committee, and also as a co-chair of the Older Women's Economic Security Task Force with the National Council of Women's Organizations. And all three of our panel speakers are NASI members, just FYI. And their full bios are in your folders. So following the panel, we are going to have ample time for the audience to ask questions. With that, I am going to turn the podium over to Kathleen Romig for Social Security 101.
Thank you. Oh, great. So Good morning. I'm Kathleen Romig. Before I begin, I just wanted to mention that I served as an intern myself 10 years ago now. I worked at the Center on Budget and Policy Priorities. And during that summer, like this summer, there was a lot of discussion about potential changes to Social Security. And I got really engaged in the topic that summer. And I went on to graduate school in the fall, and I decided that I would study Social Security. And I ultimately made my career in Social Security. And I'm so happy that I had that early exposure to the program and to the values behind the program. And I'm so happy that all of you will have that experience this summer, and especially today, and that I can be a part of that. Now on to my presentation. My presentation is entitled Social Security 101, and I'm focusing on the benefits side of the equation. We have other people who are going to be talking about all kinds of other facets. I'm going to be talking about benefits. And my three takeaway points for you this morning are, number one, Social Security benefits everyone. And when I say everyone, I mean everyone. Everyone in this room, whether or not you're receiving a check. Get more into that soon. Number two, I want to put Social Security and benefits into perspective. How much are they? How do they compare to other things? Number three, I want to reassure you, as Hillary has already done so enthusiastically, that Social Security will be there for you. And I'll explain why that is, so that you can dispel myths about the fact that it will not be there for you, which is a very common misperception. I'm also going to give you some more technical details about how Social Security benefits are calculated, pay attention to that part, because later on today, you are going to be creating your own plans about what to do with Social Security, and you'll need to know about how the current system works. My first point, Social Security benefits everyone, and that means you. Who's getting Social Security benefits? Currently, about 1 in 6 Americans. And contrary to popular perception, Social Security is not just a retirement program. As Hillary eloquently mentioned, many surviving families of deceased workers are beneficiaries of the program. So if a parent dies or a spouse dies, their family members may be eligible for Social Security benefits. In addition, and Scott's going to get a lot more into this next, people who become disabled and are unable to work also receive Social Security benefits. So that's important to keep in mind. Social Security does not just help those people who get the check or the electronic debit or credit, since we've phased out the checks. They also help everyone in their households. So if you're being raised by a grandparent, your grandparent receives Social Security, that indirectly benefits you. It also benefits children like me. I don't have to support my parents in retirement because they have Social Security to rely on as well as their own savings. And so I'm able to focus on raising my own family and putting my savings toward their college funds and my own hope to have a house one day. God, in DC market, I doubt that's ever going to happen. And even if you don't need it today, Social Security is there for you. If you walk out of here and get hit by a bus, maybe you'll be able to get disability benefits. If your spouse dies, then you'll have some help in raising your children with that Social Security check. And of course, when you retire, it will be there for you as well. Beyond just ourselves and our families, Social Security helps our whole economy. Those checks keep coming in, good times and bad. And bad times like this one, you can appreciate what a consistent source of income does for all the business owners and everyone else in our economy when people are able to continue to go out and spend money. So, who pays into Social Security? Well, the short answer is you do. Nearly every American worker pays into Social Security, 94% of workers. There are a few exceptions, but I think it's very important to note that all members of Congress do pay into Social Security. You may have received email forwards telling you something different. I have received many of those from my uncle. So tell your uncles or whoever else is sending those things that that's not true. That's a myth. Every member of Congress, as well as the president, contributes to Social Security. There are some small exceptions, including some state and local government workers, although the majority of them do contribute to Social Security, and some federal workers who were hired before 1983. But again, the majority of federal workers do contribute. Contributing to Social Security is important because it's by contributing that we receive credits for benefits in the long run. 10 years of contributions are required for retirement benefits and fewer for survivors and disability benefits. So how much are we paying into Social Security? This used to be a very straightforward question. Unfortunately, 2011, it's not so straightforward. Typically, employees contribute 6.2% of their earnings, and their employers contribute another 6.2%. This year, we have what's known as the payroll tax holiday, so employees are only having 4.2% deducted from their paychecks. It's important to recognize that this doesn't affect the solvency of the program because every dollar that is lost to the trust funds is being transferred from the general fund of the Treasury into the Social Security trust funds. And it's also important to recognize that Social Security benefits are based on earnings, not on contributions, and so this payroll tax holiday will not affect your ultimate benefits. The payroll taxes are capped. You may have heard about this cap at $106,800 in 2011, and this cap changes year to year. What that means is that, say you are a first-year law partner and you make $150,000 a year. Lucky you. You pay the exact same dollar amount in taxes as, for example, Bill Gates. And this year that will be about $11,000, counting both the employer and employee contribution. For an average earner, it's more like $4,000. And we'll get a little bit more into what that tax cap means. But one of the common proposals to change Social Security is by increasing or even eliminating that cap so that people pay Social Security payroll taxes on every dollar of their income or on a greater proportion of the dollars of their income. And it's important to note also in talking about that cap that benefits are only paid on the earnings up to that cap. So Bill Gates isn't getting a $10,000 a month benefit or something like that. He's getting the same benefit that he would get if he had been earning $110,000 a year or thereabouts. So where does all of this money go? Well, since everyone loves to talk about the budget right now, let's note that Social Security spending is about 20% of overall federal spending. Right now, it's the largest single program, but very soon it's going to be eclipsed by Medicare. It's about $713 billion in 2010. 99%, more than 99% of Social Security spending, goes toward benefits. Less than 1% goes towards administrative costs. So next time you hear about government waste, fraud, and abuse, remember that this is far more efficient than any investment company and far more reliable too. Now on to my next point, putting Social Security benefits into perspective. As you think about how to change Social Security later on today, think about how much current benefits are and how much current beneficiaries rely on them. As Hillary mentioned, Social Security has often been called part of a three-legged stool, and for current retirees, that's more or less true. They rely somewhat on Social Security, somewhat on savings, and somewhat on pensions. But for you, that is indeed going to be different, and not so. It's going to be a little more shaky of a stool. So how much does the average beneficiary get? Well, as you can see on this slide, it's right around $1,000 a month across the different beneficiary types. Stop and think about that, $1,000 a month. How far would $1,000 a month go, for example, in Washington, D.C.? I know I could not afford the rent on my two-bedroom rent-controlled apartment on $1,000 a month. And in fact, I looked up how much do typical seniors pay for their housing. It turns out that's about $1,000 a month. And they also need to put food on their tables, pay for transportation, for health care, obviously, that's a huge expense for seniors, all kinds of other things. And so these benefits are pretty modest when you think about it in comparison to how much money you spend. Thankfully, most seniors do have other sources of income. And for a typical beneficiary, Social Security makes up about 2 out of every $5 of their income. The others, as we've mentioned, are savings and pensions primarily. And earnings, that's another big one. And so that obviously diminishes as people get older and they stop working. Reliance on Social Security varies dramatically based on income level. The pie chart on the left shows the poorest 20% of the population. And for those people, 4 out of every $5 of income comes from Social Security. Among the richest 20%, only 1 in every $5 comes from Social Security. And as you can see in that chart, nearly half of those people's income comes from earnings, but that's only going to last for so long. People aren't going to work forever. To put Social Security benefits into international perspective, let's take a look at developed countries, the OECD nations, and how Social Security stacks up. One measure of how generous a pension system like Social Security is a replacement rate. And that's simply comparing your income prior to retirement to your income from the pension. And it's called a replacement rate. So Social Security, for example, replaces about 40% of a typical retiree's pre-retirement income. Across developed nations, that average is is a little above 60%. And as you can see in this ranking of developed countries, the U.S. system ranks pretty near the bottom. Now, before I move on to my next point, I jokingly called this section of the presentation, "Nobody gets rich off Social Security," and that's true. But another equally important point in putting Social Security benefits into perspective is that Social Security keeps a heck of a lot of people out of poverty, too. And in fact, as Hillary mentioned, before Social Security, estimates indicated that over half of American elderly were in poverty. As Social Security became implemented and the coverage expanded and benefits increased, that level of poverty dropped dramatically. In 1959, when people started tracking poverty officially, about 35% of elderly Americans were in poverty. For the last couple decades, that level is closer to 10%. So that's really dramatic accomplishment. Now, on to the technical stuff. How are benefits calculated? I'm going to try to keep it simple here, but feel free to ask more questions in the Q&A. Here's the basic benefit formula. I'm not going to read it. I'm not going to go over it. But I want you to know 3 important points, which I'll elaborate on in a moment. Number 1, benefits are based on your earnings. Number 2, the benefit formula is progressive. Number 3, initial benefits are indexed to wages. So, benefits are based on earnings. What does this mean? It means that the more you earn, the more you get in terms of the dollar amount of your monthly check. So using these hypothetical workers as examples, a maximum earner, someone who is earning the equivalent of that $106,000 every single year for their highest 35 years of earnings, would get over $2,000 a month. A low earner, someone who worked every year, but at a low rate, would be getting less than $1,000. And someone who had a weaker attachment to the labor force, someone who didn't work 35 years, would be getting less than that probably, assuming they had low earnings. Now, the flip side of this, oops, sorry, I went backwards. Flip side of this is that the benefit formula is progressive. And what that means is, we talked about replacement rates already. For lower earners, Social Security replaces a greater proportion of their pre-retirement earnings than for higher earners. So for a low earner, over 50% of pre-retirement income is replaced. For a maximum earner, it's more like 30%, less than 30% actually. Wage indexing. I'm not going to get into a ton of detail here, but one possible reform proposal is to what's known as price index benefits. And so you need to know why the current indexing system is important. And basically those elements of the formula that I was showing you before index to what's known as the average wage index. They rise as earnings in the country rise. And wage indexing allows beneficiaries to reap the benefits of rising living standards, provide steady replacement rates over time, and recognizes that Social Security workers' contributions increase as their wages rise. Now, it gets a little more tricky once you actually begin to collect benefits. After that first year, your benefits are increased with inflation, not with wages. And that allows benefits to keep up their purchasing power over time. This is important because, as you may have been reading, there's some talk right now of changing the way inflation is measured in increasing Social Security benefits. This change under discussion would be a technical tweak that would lower Social Security benefits. And we can talk more about that if you have questions. Now, my last slide about the current benefit formula, just the basic benefit formula, I should say, is that this, of course, they have to make things as tricky as possible. And many of the parts of the Social Security benefit formula revolve around the full retirement age, which is, in fact, a moving target. For most of Social Security's history, it was age 65. Currently, it's age 66. And for all of you born presumably after 1960, it'll be 67. And that means that's when you get 100% of your basic benefit amount. You can retire at age 62 and get a reduced benefit, as we'll discuss in a moment. Any further increase to the full retirement age would be a benefit cut for all workers. That's important to keep in mind. And this is why, because the benefit formula works basically, it's more like a sliding scale. People get attached to this age, 65, 67, whatever, but it's really a sliding scale. And it depends how much you get depends on when you collect your benefits. So using this example of someone who would be getting a benefit of $1,000 at age 67, if that person chose to collect it at age 62, it would be only $700 a month for the rest of their lives. If that same person chose to retire at age 70, $1,240. Now, of course, the person who collected at age 62 would be collecting for a longer number of years, and so overall it all comes out in the wash. Another adjustment is based on people who continue to earn income after they collect benefits. And that's a reduction in the short run, but it increases benefits in the long run. Finally, workers' families, as I mentioned, may be covered. So this means that if a parent dies, his or her child could be eligible for Social Security survivor benefits, or a stay-at-home mom who didn't have earnings of her own may be able to get benefits based on her husband's earnings. Those benefit amounts are based on the worker's earnings history. Now, on to my last and really most important point. If there is one question that I get asked at every cocktail party when I say that I work for the Social Security Administration, it is, will Social Security be there for me? And the questions are especially anxious from younger people. In fact, polling shows that young people have the least amount of confidence in Social Security's future. But I'm here to tell you that is not true. There will be benefits for you, and I'll explain why. For the most part, Social Security benefits are paid out of current tax dollars. So that means the taxes you're paying today are used to fund your grandparents' benefits or maybe your parents' benefits. That means as long as people are working, Social Security benefits will be paid. And I hope people will be working by the time we retire, 30, 40, 50 years down the road. I'm sure they will be. Even if we do nothing at all, Social Security payroll tax contributions alone will be enough to fund more than 3/4 of promised benefits. Now, what does this mean? It means less than you were promised, but adjusted for inflation, that is actually the same dollar amount as today's beneficiaries receive. So next time someone says to you, oh, that's not worth it, why are we paying those taxes, it's not going to be there for me, you can tell them with certainty, yes, it will. Thank you very much.
Thank you. Next, I'm going to turn it over to Scott Szymendera, who is going to be talking about the Social Security disability programs.
Good morning, and thank you, Sarah. Sarah Berkowitz is an intern with us at CRS, Congressional Research Service, but I would be remiss if I didn't also mention that her grandfather, Monroe Berkowitz, was one of the pioneers of NASI and really one of the pioneers of disability research. And her father, Professor Ed Berkowitz at George Washington University, is also a NASI member. So this is a third-generation NASI participant here, and judging from her work at CRS this summer, I think she's well on her way to Academy membership herself. Kathleen did a very good job giving an overview of Social Security and mentioned briefly that Social Security is more than just retirement and survivors' benefits, but also includes provisions for persons with disabilities. In fact, the Social Security Administration administers 2 disability programs: Social Security Disability Insurance, SSDI, and Supplemental Security Income, or SSI. Now, because of the limited time this morning, we're going to pretty much focus on SSDI because that program is part of the traditional Social Security system, paid out of the trust funds, and is an insured program, but we'll also touch on supplemental security income as well. So if you do hear someone talking about Social Security disability, sometimes you have to clarify exactly what they are talking about. And in fact, sometimes even the beneficiaries themselves may not fully understand exactly what program they're in. So what about these programs? SSDI is what we call an insured program. Just like Social Security retirement, you pay a portion of your Social Security payroll tax for the disability program. You are buying insurance against the day when you may be unable to work because of a disability. As Kathleen said, you might get hit by a bus, in which case, hopefully, you have a good lawyer and can sue and you don't even have to worry about SSDI. But if you have another sort of traumatic disability, or, as is more often the case, a non-traumatic disability, such as a deteriorating health condition, and you reach the point where you cannot work, SSDI will be there for you if you paid into the system. SSDI provides benefits for working-age adults and their dependents, and that's important as well, because if the primary earner in a household is no longer able to work, there has to be some provision for the dependents. Once you receive SSDI, after a 2-year waiting period, you can also receive Medicare, which will cover your health costs. And SSDI benefits are paid out of the DI trust fund. When we hear about the Social Security trust funds, there are 2 trust funds: the OASI fund, which funds retirement survivors, and the DI trust fund, which funds the the SSDI program, its benefits, and administrative costs. Contrast that quickly to SSI. SSI is a means-tested program, which means you have to have income and assets that are very low to qualify. It provides benefits to individual children, adults, and seniors. It does not provide family benefits. If you're on SSI, you generally are eligible for Medicaid, and SSI is not financed by the Social Security tax system or the trust funds. It is paid out of general revenue, just like other programs in the government, paid out of your income tax and other general revenue of the United States. So what does it mean to be disabled? Well, if you spend a lot of time at bars, as Kathleen does, no, I'm kidding. You will, we used to work together, so we can, I think we started the same day, didn't we? Yeah. We can, I can say that. You'll hear people talk about, well, what does it mean to be disabled? Well, here you have these two gentlemen at a bar saying, you know, you can collect for disability. I don't know about inability. Well, what does it mean actually to be disabled and qualify for SSDI or SSI? Because the definition of disability is basically the same. And that is, you have to have an impairment that causes an inability to work. So these are the two important components. First off is an impairment, medically determinable, physical or mental impairment. And that's important, that it can be a mental impairment as well, and in fact, that is the fastest growing component of the Social Security disability programs, are people with psychiatric conditions and other mental impairments. The impairment must be expected to last 1 year or result in your death. This is not a program for short-term conditions. This is a long-term disability program. And the impairment must cause an inability to work at what's called the substantial gainful activity level, which is an amount set in the law. It's currently $1,000. It's adjusted every year, although it wasn't adjusted the last year because the economy is not, wages are not growing. But you must be unable to work at the substantial gainful activity, or SGA level, in your past job or any other job that exists in the national economy, taking into account your age and experience. Any other job that exists in the national economy. Meaning, when you apply, if Social Security Administration looks over your file and says, you know, you probably could do this job that's out there, you will not qualify for benefits. Even in an economy like this, where there are jobs, but they may not have any openings, doesn't matter. Two things about this definition. Number one, this definition is very different from the definitions of disability used by other government programs. The Americans with Disabilities Act, that many people are familiar with, uses a totally different definition of what is a disability. There are people who can file Americans with Disabilities Act claims and be successful, who would never be successful in applying for SSDI or SSI. Department of Veterans Affairs has its own disability program for members of the military who are disabled. The definition of disability for veterans is different than SSDI. In fact, there are people who come who we get calls from members of Congress's offices quite frequently on this. Say, I have a constituent. He served in Iraq or Afghanistan. He or she was disabled, applied for disability from the Department of Veterans Affairs, was approved, applied for SSDI and was denied. How can that happen? Well, it can happen because the two programs are separate and have separate definitions of disability. Also, things like workers' compensation, disability pensions for federal employees, all have different definitions. So just because the government at some point has said you are disabled does not necessarily mean you're going to receive SSDI. The second important part about this definition is this is a strict definition. You have to basically be totally unable to work at all. That is a very strict and a very high standard to meet. SSDI and SSI are not general disability programs. They are programs for people who cannot work because of their disabilities. Now with SSI, there's a component for children, obviously. It's a little bit different. But for adults, that's the standard. And that's a strict standard, and a standard that many people do not necessarily understand, including people with disabilities who apply and are turned down. So, someone says, you know, you can't collect for inability. Well, if your inability is caused by your impairment, you can. Now, one of the questions I'm asked quite a bit is, congressional staff will call me and say, can someone get on SSDI if they have X disease? The answer is yes, and the answer is no. There is no master list of conditions floating out there that you must meet. You must meet that standard of a medically determinable impairment that results in your inability to work. And that impairment can run the gamut, as you can see on this chart here. So if you look back in 2009 and the people who receive benefits, the most common condition among workers, SSDI workers, were musculoskeletal conditions, mental disorders, 22%, circulatory system, and then all others. You can contrast that with your SSI groups. As you can imagine, SSI children don't have a lot of musculoskeletal conditions or circulatory system conditions. So when you apply for disability, what happens? Well, there's a 5-step process here, which we'll talk about very briefly, that SSA uses to determine if you're disabled. First is work test. Are you working? Can you work? Yes or no. Severity test. Is your condition severe? Then we get into the medical listings test. And you say, well, what are medical listings? You just told us there was no list of conditions. Well, there's no list of conditions, except there is a list of conditions called the Blue Book. Although I don't think they publish it anymore. It's all online, so it's not really blue, but it's called the Blue Book. The medical listings are a list of conditions deemed so severe that if you have one of the conditions in the book and you have the symptoms listed in the book, then you jump ahead and you are awarded benefits. The idea is these conditions are so severe, they don't really have to look at your ability to work, because if you have the condition, there's probably very little chance you can work. The medical listings are often, people get confused. They think that's the only thing that gets you to qualify. No. In fact, a majority of people who qualify don't qualify because of the medical listings. Medical listings are there to kind of speed the process up. Real quick, the medical listings are evolving, and in fact, the current Social Security Commissioner has made it a priority to update the medical listings. There was a time, you guys are too young to remember this, but there was a time when if you were diagnosed HIV positive, that was in the medical listings, you were given SSDI. It was a death sentence, you would die within a year, there was no possible chance you could work. Now, a simple diagnosis of HIV positive, you will not get on the SSDI rolls. Because as we know, with medication, certainly it can be managed to the point where you can work. So there's a case of the medical listings evolving. This chart you should study in your leisure, but this shows you the process. The most important thing to take away from this is, at the initial application stage, only about 37% of SSDI and SSI applicants are approved. The majority of people who apply are turned down initially. Then they go through this complicated appeals process. Among those who appeal, 64% are eventually approved. This is an ongoing issue with the program. Why can't they get the decision right the first time? There's a lot of reasons for that. Average monthly benefit, and I think Kathleen addressed this. You can see for DI it's about $1,069. For SSI, the benefit formula is based on federal benefit rate. Your income, any earnings, including other government programs, takes away from you. So you can see the amount of SSI is much lower. And then, of course, you can see here the data. What we're looking at, about 10.5 million DI beneficiaries, another 8 million on SSI. About 2.5 million receive both. And in terms of issues, these 4 issues all are sort of linked, right? Solvency and budget. and I know later today you're going to talk about the solvency of the DI trust fund, which is in, I guess you could say, worse shape than the OASI trust fund. Administrative backlogs is an issue. That appeals process takes a long time. Right now, it takes about 100 days to get that initial decision. Once you get in the appeals process, it's not uncommon for people to wait over a year, if not longer, to ultimately get their case decided. And while they do receive retroactive benefits, that's a long period of time to be in limbo, and that results in a series of problems. Return to work. SSDI is a long-term program, but it's not necessarily a permanent program. If you can return to work, so much the better for yourself, because you'll start earning money, and so much the better perhaps for the economy in general. The return to work rate, only about 3% of the people who go on SSDI ever leave because of work. That has been an ongoing challenge at SSA and in Congress to try and improve that. And then finally, program integrity issues. While the program is not necessarily rife with fraud and abuse, there are certainly program integrity issues. And this is the update from last year to this year. All of these issues are now affected by the economy, especially the unemployment rate. Because there are a group of people out there who in a strong economy are working, but who also have conditions that are sufficient to get on the SSDI rolls. Now, they'd rather work, but what happens when those people lose their jobs? Well, they then turn to the SSDI program. We've seen a dramatic increase in SSDI applications, SSDI awards, SSI as well, especially because you have families whose income has dropped and now fall below the means test for SSI. And so all of these policy problems, which have been around almost from the beginning of the SSDI program, they're all made worse now by the economy. And so with that, I will take my seat and answer any questions that you have. Thank you.
He will answer questions during the Q&A period, which is going to happen right after Ashley Carson Cottingham comes up to talk about benefits adequacy, which will be right now. I apologize for being late. So I'll just tell you a little bit about what I'm doing right now while Derek sets up my presentation. So I work right now for the Health, Education, Labor, and Pension Subcommittee on Primary Health and Aging. And my boss is Chairman Bernie Sanders. He's an independent from Vermont. And he just became the chairman of this subcommittee at the beginning of the Congress, and we'll be focusing a lot on the Older Americans Act. Thank you. And he also, is very concerned about the economic security of older Americans, and he founded a caucus in the Senate to protect Social Security and strengthen it, and he's been very vocal about how important the program is for all Americans. So I've been asked to talk about adequacy of benefits, and I regret that some of my talking points are going to be duplicative of what you've heard before, but I assume you'll hear a lot of the same things throughout the day. There'll be recurring themes. So this is a great chart that was put together by NASI, I think a year ago or so, and it shows, just how much people are relying on Social Security for their retirement income. So if you look at the chart, you can see in the lowest fifth, the lowest income people are relying on Social Security for 83% of their total income. So that's quite a bit. But then if you look at the next to the highest fifth, people are still relying on Social Security for close to half of their retirement income. So that's quite a large amount. And then I also like to point out that the next to highest fifth is only
people that have $55,000 or so in income. And when you think about the cost of retirement and the cost of, say, long-term care, right now the average cost of a year in a nursing home is $70-some thousand. So this is not a lot of money to retire on. So again, I'll reiterate why we should care about adequacy. A lot of these points have been made, but people rely on Social Security. Older Americans, disabled Americans, and sometimes children who have lost a parent. The benefits are not all that generous. So an average American is getting about $14,000 a year. And then that number drops pretty dramatically by almost $2,000 for women. So if you think about living on around $12,000, I think that's hard for most of us to imagine in a year. The other thing is that when your benefits start, they never run out. You get that benefit throughout the whole entire rest of your life. This is something different from any other source of income or savings. So with your pension, the value might erode over time. With your savings account, when the money is gone, the money is gone. That's not the case with Social Security. It's a lifetime benefit, which makes it unique from any other source of retirement income. So why should essentially young people, I know there's people of all ages in the room, but why should people who are younger care about the adequacy and solvency of Social Security? You've heard a lot in the media lately through budget negotiations about cutting benefits or adjusting, as Kathleen mentioned, the way that we determine the COLA or cost of living adjustment. Well, we should care because what it means is when we all start to collect Social Security benefits, we will see significant decreases if those types of measures are adopted. As Kathleen has said, if we don't adopt those measures, we can all expect to have, great benefits, as much as we expected, and actually more than previous generations. So when you hear people talking about what the trust fund will be out in 2070, you can think about the fact that you will be reaching your 80s in that point if you're in your 20s right now. So what do you need in retirement just to get by? There's a lot of great work that's been done by the organization Wider Opportunities for Women in their Elder Economic Security Index. And one of the members of NASI, or maybe several members of NASI, are also working on this over at WOW. So you might hear more about this by being connected to NASI. But a renter in good health in retirement would need $20,000 a year. So when you compare that to the reliance on Social Security and the low benefit amount, you still need to make up a significant amount of income somehow to get by in retirement. And if you own your home but you are still paying a mortgage, you would need $24,000 a year. And if you own your home completely, you still need around $16,000 a year if you're in good health. And like I mentioned before, if you are in not so good health, and the cost of health care is increasing, you're going to need to figure out how to find some more income in retirement. So retirement security is based on many things, but the adequacy of retirement income is assessed in terms of replacement rates, also something Kathleen just mentioned. So how much of what you were earning in your working life will be replaced by your retirement income? Right now, Social Security is replacing about 39% of a median earner's income in retirement at age 65. But this will decrease slightly to 32% replacement income because there's already a retirement age increase in place that will affect most of us. So here's some ideas on how to expand benefits or improve benefits. There's a lot of talk about cutting benefits, but given what we've seen in that the benefits are great, but maybe not quite adequate enough to have a very secure retirement, here's some ideas that have been floated through NASI and other organizations to improve benefits. So years ago, the student benefit for a student who had lost a parent lasted up to age, I think, 22, maybe 21, 22. But that was changed in the 80s and dropped back down to 18. So prior to that, you would receive that benefit throughout your college years, and it was really instrumental in helping those particular kids who lost a parent have income while they were in college and completing a college degree. Right now, it's only at 18. So we could talk about changing that back to the way it used to be and making it 22 again. Another idea that's been talked about quite a bit for years and years is allowing caregiving credits to be factored into your eventual Social Security benefit. So for women, generally they spend about 7 years on average out of the workforce caregiving, both for children and for spouses and for aging parents. So it would be great for women's economic security to factor in a certain amount of money that could be determined by policymakers into the earnings of a particular person over their working life, which would then bump up their monthly amount when they retire, and they wouldn't be penalized for that time that they spent out of the workforce giving care to kids or aging parents or a spouse. So the other thing that happens is when you reach your mid-80s and you become what people refer to as the oldest old, the value of your other savings has eroded over time. And so we might want to think about giving sort of a bump up in benefits if you do reach that age. So maybe, it could be determined, but a 5% increase when you reach 85 would help make up for some of the difference in the value of the other assets eroding. Widows are often hit fairly hard. They're receiving a certain amount if they are in a retired couple, and when the spouse dies, the benefits are changed such that widows are left with quite a bit less money in a month. So we could, play with the formulas a bit and ensure that a widow receives close to what they were getting before being widowed. And when you look at the statistics, we know that women who are single at age 65, almost 45% of them are living in poverty. So that's a large number of people that could possibly benefit from this type of a policy change. And then we could even talk about, giving people more benefits in retirement, giving people higher benefits, and stop the talk about cutting benefits. I think you'll hear more about this later, but this is something that my boss recently requested. There's a division of the Social Security Administration, their retirement research division, that works on a model called the MINT model, and it's a micro-simulation model to show the impact of particular changes in Social Security over a long period of time. And it shows sort of individual impact. And the interesting thing about the model is that it can factor in other sources of income and family or household income, and that makes it slightly different from some of the numbers that you hear from the chief actuary. So my boss asked that these numbers be run just looking at changing the way we determine the cost of living adjustment to the chained CPI. And here's some of the numbers that have come out. So there would be 173,400 more people living in poverty. Widows will receive, $840 less over a year. Overall, women will receive a 3.5% cut, men a 2.9% cut. When you go to 2050, you have a projection of even more people living in poverty, and then the cuts get a little bit deeper. So we're talking about $1,200 less for a widow in retirement. because of the way that poverty is determined, in 2070, the numbers of people living in poverty actually goes down under this model, but the dollar amounts in benefit cuts do continue to go up. And as you can see, the oldest old, the 90 plus, are hit the very hardest. So in 2070, people who are 90 are receiving over $2,000 less per year. So I just pull this back up again so that we can all remember that it sounds like 2070 is a long way away, but these types of cuts will actually hurt us the most. There's wide public support for Social Security. This is a poll that was done earlier this year showing that 77% of people do not think it would be acceptable to cut Social Security in the context of budget negotiations. And my boss, again, has been very vocal about his support for the program. These are points that he makes time and time again, and he's really calling on all Americans to ensure that Social Security is not targeted in the midst of our budget negotiations, that we need to strengthen the program, and that there's a bunch of other ways to fix our deficit and our budgetary problems without cutting benefits for some of our most vulnerable Americans. And these are some of my favorite posters. These are when Social Security was first enacted. They did a lot of campaigns to promote the program, and I think that they show it's a great program, and it's for families, and it's for widows, and it's for some of our most vulnerable, and it really does keep a lot more people out of poverty than were before the program was enacted. So we need to keep it strong, and I look forward to your questions. Thank you.
Okay, thank you. So we have our Q&A session. If you could get the attention of the people coming around with cordless mics, just raise your hand and they'll find you. So if anybody has any questions, please briefly identify yourself and try and keep your question as short as possible so we can get as many questions as we can in there.
Was the age for, survivor benefits for children lowered?
Someone can correct me if this is wrong, but this is what I remember. I think it was in the context of negotiations that happened in. Is this on? Yeah. Yeah. Okay. In the context of negotiations that happened in the 80s when they were looking at the solvency of the program. And trying, there was a much more immediate crisis in the solvency of Social Security, and so a number of changes were made back then, and I think that was one of the pieces of the negotiation. Is that right?
It did happen in the 80s, but it was actually prior to the 1983 amendments.
Okay.
It was just part of general budget cutting. Like the kind of situation that we have right now when they're talking about overall budget cutting. It was in 1981, I think.
Okay.
Yeah.
Hi, my name is Garrett Fields. I've got just a general question about the payroll tax cap. I work in a congressional office, and I got a call from one of our constituents that was pretty much saying that he has a grand idea to save Social Security, and it was about raising the payroll tax cap. I realized I know absolutely nothing about this. So I was just wondering, first, how did we reach the figure of $106,800? And second, what would the financial implication be of actually raising the tax cap, as well as also raising the subsequent benefits to people who do earn more than $106,000?
I think I'm probably best equipped to handle this one. Actually, even better is Steve Goss, who's the Social Security's actuary, is going to be talking later. So I definitely recommend bringing this one up again with him because he's the guru as far as how anything would affect solvency. But as far as how we came up with that $106,000 figure, it's changed over time. And it's covered sort of different proportions of people's earnings, different shares of wages in the economy, and there's been sort of a back and forth about it. And the last time it was changed explicitly so that it would cover 90% of aggregate wages in the economy. And that's a target that people want to continue to meet. Some people want to continue to meet. And right now it's covering, I don't know exactly, but somewhere in the low 80s. I think it's something like 83% of wages in the economy. So if we increased it back to that 90% level, it would be more like $150,000 a year. And that would bring in significantly more revenue to the program, even if we credited those additional wages toward benefits. And some people talk about crediting them, some people not. Because, like as I was showing you in that benefit formula, those dollars, those high dollars, you get only a 15% marginal return on those dollars. So for every dollar going in, you only get 15 cents back in the form of benefits. So it's still a boon to the program solvency. I wish I could remember offhand what the solvency impact would be of different kind of iterations of changing the tax max, as we call it. But I know if you completely remove the cap and didn't credit it for benefits, it would practically solve the problem. But there are serious equity concerns raised by that sort of approach. But if you raised it to cover 90% of aggregate wages, and if you did credit those additional earnings toward benefits, it would solve a big chunk of it. It's definitely less than half. I can't remember the exact figure, but it would definitely go a long way in solving the solvency problem and in sort of sharing the gains and costs of the program more broadly.
Hi, my name is Jessie O'Hara, and I'm an intern at HHS. This question is for Mr. Szymendera. You briefly mentioned the medical listings test review, and I'm curious to know a little bit more about what are the components of that process and how often that review actually occurs.
That's a good question. It used to be very haphazard. The process, it goes through the public comment process. It's published in the Federal Register. There's some legal things that have to be done. The current plan is to make sure that all the listings are updated at least once every 10 years. And they've been working on that at SSA. They have a team of people, some of whom are medical doctors, vocational experts, and others. And I know that they've had public forums throughout the country on this, when they're working on a specific listing, so that people can come to meetings and express their concern. And then, of course, public comments are submitted via that formal process. Those are taken into account. So the current plan is updated every 10 years, whereas before it was a lot more haphazard. And said it's a concern because it is an opportunity for people to, if they have a condition that's deemed so severe, to not have to go through those sort of last two steps in the process, which can save them time. The one other thing that sort of is similar to this that Social Security is doing is you may hear about something called compassionate allowances. And this goes all the way back really to President Bush and the previous commissioner. There was a concern that it used to be everybody who applied for SSDI was put in line, sort of first come, first served, which meant you could have a case that's a pretty clear-cut case. I mean, somebody with ALS or some sort of cancer, very severe, affecting multiple body systems, pretty clear-cut case. But they might have to wait in line behind a marginal case that might take a considerable amount of time to process. So there's been this ongoing effort. How do we identify the clear-cut cases and deal with them first? And that is now called compassionate allowances. And there's a computer model and some other things that try to look at applications and screen out those that are clearly going to be approved quickly, and approve them quickly within a matter of days. That frees up the disability examiners to work on the harder cases. And that's something that's a current initiative as well. And again, what conditions should be on the list of compassionate allowances and what shouldn't is an ongoing process as well.
Hi, my name is Sarah Jordan, and I'm an intern in Ms. Cottingham's subcommittee at the Senate. My question is for Ms. Romig. First of all, thank you very much for your very comprehensive and thorough explanation of the structure and financing of Social Security, which I learned very much from. Question I had is regarding the last 30 years in U.S. history, we've experienced very little real wage growth for most income brackets. How has that affected the revenue generation for Social Security, and how do you think that might change into the future? And by the way, before you answer, thank you very much for a very optimistic ending to your presentation. I really felt reassured that Social Security would be there for us in the future.
Thank you for your question. Well, wage growth is a funny thing. It's not shared equally. And in fact, this kind of came up in the last question, that while wages have stagnated among middle-income workers, they've increased dramatically among the very highest income earners. And that's why when they last set the tax max at the level that they did, covering 90% of earnings, that's really eroded, because those wages at the top of the scale have increased so much that the share of wages above that max have really, really grown, almost doubled. And so that has affected Social Security revenues in a bad way, because so much of the earnings growth has occurred above that cap. But overall, wages have, thank God, continued to rise at least faster than prices, so Social Security benefits continue to increase with the standard of living. So that's good. So there's some good news, but there's definitely some bad news on the revenue side, as I think you suspected.
Okay, I'm Damian Schuster. I'm with Senator Tim Johnson. And my question, I think, was to Mr. Szymendera. The question, you did touch on SSI, and my question was about the limited assets capped at $2,000. And I know it hasn't really been changed since 1989. And given the higher prices of cost of living and post-secondary education prices, why do you think it's indefinitely set in law that it won't ever change from $2,000?
Well, I don't know if it'll never change. The reason it's not being changed is because SSI, as we said, is not financed through the Social Security payroll tax. It's financed through general revenue, or as some people say, real money. And meaning every extra dollar you spend on SSI is either going to contribute to the deficit, or you're going to have an offsetting cut somewhere. And so any proposal to increase that will increase the costs of SSI is probably politically a non-starter, not only right now, but certainly has been in the past several Congresses. And so there have been a number of proposals to increase the asset limit. And as he mentioned, to get on SSI, your personal asset limit is $2,000. They exempt your house, your car, a few other things. But what it does is not only does it prevent people from getting on the rolls, but it keeps people on the rolls in a sort of perverse incentive, because it prevents them from building up a savings that they might use as a safety net if they leave the rolls and try to go back to work. There's been a lot of proposals to index it to inflation, for example, retroactively index it so that we can sort of jump ahead. But the reality of the situation is there's not a lot of extra money or any extra money floating around in the general revenue side. And so any proposal that increases SSI is going to be extremely difficult in this climate, and I don't know how far into the future, but certainly in the near future as well.
Can I just say something really quick? I forgot. I'm supposed to be. I need to do a disclaimer in that I work for a senator, and my remarks are my remarks alone. And so, unless I don't know if there are any press interns here, but please keep my remarks off the record. And certainly, if you want a quote from the senator, I can work with our press office to get you something. And of course, the talking points that I mentioned are the senator's talking points. Those are his words. So, thank you.
Thank you. So join me in a round of applause for our fabulous speakers. Thank you, guys. So we're going to have a 15-minute break, and followed by that, there'll be session 2, which is Social Security, how big is the financing problem, and how can we pay for what we want? This is the one that Steve Goss is going to be speaking at. He's the actuary at the Social Security Administration, and Ben Vecti of NASI. So stick around. Be sure to fill out your evaluation forms, and you can get a giveaway if you fill them out. So big deal. All right. Thank you, everybody.